Welcome to Central Health, brought to you by the Herbert H. and Grace A. Dow College of Health Professions at Central Michigan University. Today we're talking with Dr. Deborah Silkwood-Sherer. Dr. Silkwood-Sherer is a physical therapist in our physical therapy program, and she specializes in hippotherapy and multiple sclerosis. Welcome, Dr. Silkwood-Sherer.
Thank you, Dean Ingersoll.
Well, what is hippotherapy? I presume it's not about hippopotami.
No, it isn't. The word hippos is the Greek word for horse. And it sort of came about because in Germany they were using that same terminology and we kept it. But what it really is a treatment strategy that is used by physical therapists, occupational therapists, and speech language pathologists. And we use it to enhance the goals we already set for our patients that we see.
So what's the history of hippotherapy? You know, and how did you get involved with it?
Okay. Well, in the 70s, there were some therapists who were horsewomen who had gotten, they were primarily female, who had gotten into working in therapeutic riding, and they began to see some changes and they began to incorporate some of their therapy goals, and they started teaching other therapists. And then in the 80s, a group of physical therapists and occupational therapists went to Germany because, as I mentioned earlier, there were German physiotherapists that were doing this, and they had called it hippotherapy. And they trained with them and brought it back to the United States, and then sort of set up an association to help teach other therapists on how to do that. I got into it because I have a daughter with mild cerebral palsy, and she liked horses, and we actually started an adaptive riding, therapeutic riding program. That's where I learned about hippotherapy. And I began to see changes, and so it's like, boy, I think my children that I was working with at the time were getting better faster. And so I thought, why? And that's when I kind of started looking at the research.
Interesting. So I can understand how physical therapists and occupational therapists would find benefit with this, but how does that relate to speech and language pathology?
Okay, well, I'm not a speech language pathologist, so I can give you my interpretation of and how I understand it. Part of it has to do with hippotherapy. We know helps strengthen the core, and that helps with the diaphragm. It helps with posture. And by doing that, what we're doing is we're providing a stable frame for the person to articulate, and they get better airflow, and we see better speech. And I actually have seen that my children, a lot of my children who've never talked, their first words are when they are during the hippotherapy session. Typically the first word is go, because we also work on cause and effect, and go makes the horse move. So go is one of the first words we tend to hear.
So is hippotherapy aimed only at children, or can adults also benefit, or what kind of disorders or problems can benefit in hippotherapy?
Primarily, if you look at it, has been thought of as for children, and if you look at the numbers from the American Hippotherapy Association, about 80% of our clients are children. However, adults do benefit, and we're seeing more and more therapists branching out to treating adults. I, for one, treat adults, and multiple sclerosis was the first group I worked with. But I know of people with stroke, people who have had stroke, Parkinson's disease, brain injury, and that obviously can be adults or children. And they all seem to benefit. And so, yes, adults can be seen as well.
Great. So if one of our viewers thinks that they might be able to benefit from hippotherapy, what would be their next step? Do they need a referral from their physician, or how does a patient find someone trained in this discipline?
In Michigan, yes, because physical, occupational, and speech language pathologists still need physician referrals. We don't have direct access in this state, and it is a typical therapy, so they do need a referral. If they're trying to find a therapist, what they might want to do is to go to the American Hippotherapy Association website, and that's www.americanhippotherapyassociation, all one word, .org. And if there's a tab that says find a therapist, and if they go there and they're listed by state, so then you can find your state, and you can go down and find a therapist, and there's usually contact information, and then they can contact that therapist about seeing about receiving hippotherapy and what kind of forms they need to fill out and those kind of things.
Great. Well, thank you so much for the information, Dr. Silkwood-Sherer. I have some more questions for you regarding your specific area on your field. For those who are interested in hearing more afterwards, please go to www.chp.cmich.edu and look for the button that says Central Health.